Good day, people. We're here to further talk about patient positioning. So previously, in the previous two videos, we spoke about the previous two concepts, the first two concepts. The first concept being the table makes stable. And the second concept means less table means I have to make the patient stable. So this video is going to be looking at the third concept, which comes from essentially or is the direct extension of less table means I need to make the patient stable. Well, how do I do that? So we talk about negative space, or the space between the patient and the practitioner where there is a lack of contact. So we have a little catchphrase, as we did with the previous two concepts here, is that the space between us is unstable. So what I want to do to improve stability is minimize the space between myself and the patient to be able to increase the amount of contact, increase the amount of stability, depending on the patient positioning. So this is not as important in supine or prone, but it is very important in seated or lateral, or when the patient is in seated or lateral. Now it is important as far as general control for safety, even in prone and supine, so I want to be as close to the patient as possible to have as much opportunity to have good contact with the patient, which we've talked about before. But what we're looking at now is ways that we can decrease the amount of space between ourselves and the patient, create more contact so that we can make the patient more stable. So we're going to move on, as we have already and with the other videos, and create patient scenarios, so create demonstrations with the patient. So we're here talking about the third concept, that the space between us is unstable. So we've dealt with the first concept being the table makes stable, so more surface area in contact with the table means the patient's more stable. Right now our patient is in supine, one of the most stable positions. Supine and prone, you have the most surface area in contact. The second concept being less table means I need to make the patient more stable. So in supine and prone, patient's quite stable. Again, I shake him here, he's not moving all that much, he's well controlled by contact with the table. The third concept being what we're talking about now, negative space is a problem, right? So we're talking about negative space, or the space that is without contact, free space. So the space between us is unstable. So right now the patient's in supine. I have a fairly narrow table. Many osteopathic practitioners will, not all. It depends on the practitioner and what they're going to do. Quite often massage therapists tend to have a wider table. Regardless of any of that, right now there's very minimal space between me and the patient because I can walk right up to the table and be quite close to them. So not only is the table controlling them, but I'm quite close to them, so there's not much negative space. I can control that. When we have the patient lay on his side, so you're going to have you lay on your side facing that way. We'll have you shimmy your hips forward just a little bit, just to describe this. So right now, between the edge of the table and the patient, there's a fair amount of space. So if I walk right up to the table, there's still space between me and the patient. And I want to minimize this for control. So again, the negative space, the uncontrolled space, I want to minimize that. So I'm going to have the patient move back towards me. So shimmy back towards me. There we go. So now I can have a greater amount of contact with the patient. I can have body contact, right? So again, less table, the second concept, less table means I need to make the patient more stable. Well, this is how I do it. I control the negative space. So if I walk away from the patient, there's far less space between the edge of the table and the patient. I can get closer to them. I've minimized the negative space. Now we're going to have you flip over and face me. Because in lateral recumbent, sometimes you're going to work in front of the patient. It depends on the situation. Right now, there's a fair amount of space between the table and the patient's torso. The patient's legs are bent to abate the movement, improve that stability, but when I walk to the table, there's still a fair amount of space between me and the patient that I can't control. Okay? So I can have the patient move towards me, but one of the problems is the legs start to fall off the front. Okay? So I'm going to have the patient move towards me just a little bit. I'm going to have him bring his knees up, and now I can control him somewhat off of his thigh. This is not the ideal situation as far as control is concerned, but the way to deal with it is to get the abdomen in contact with the patient's, essentially the patient's pelvis, or like their iliac crest, their ASIS, however you want to term it, and then also to use a hand to control the upper body. Now we're not going to worry too much about that right now. We'll talk more about that when we do our next video series about the intricacies of each position. But what I'm going to have you do now is I'm going to have you sit up and face that way, face towards the wall. Thank you, sir. Okay. So we're talking about negative space here. In seated, depending on the height of the patient, there may be more or less negative space built in based on the length of their femurs. So marked right now as just sitting on the table, just naturally, there's a bit of space between the patient and the edge of the table. I have to control that. I would control that by getting close to the table and using body contact. However I end up doing that, depending on what is required, I can do that. I can increase the amount of contact I have with the patient. Now, are you able to slide back a little bit farther? You can have the patient move back a little bit farther, but depending on the length of their femurs, they may be blocked from coming back farther. But I can remove some of that negative space by having the patient come back a little bit more. But the shorter their femurs, the less they'll be able to come back. So the way to control that in a seated position is to walk towards the table, get in contact with your patient. As much body contact as you can have, you're going to have more contact with the patient, more surface area of yourself in contact with the patient. You're going to be able to control them better, keep them safer.